What is the best treatment for men with metastatic hormone-sensitive prostate cancer? Here at the EAU, new treatment options were discussed, and it's clear standard of care is ADT in combination with new hormonal agents like apalutamide, enzalutamide, abiraterone, or chemotherapy with docetaxel. This morning, data from the ARASENS trial were presented, which is a combination of chemotherapy, docetaxel, 6 cycles with darolutamide compared to chemotherapy alone with docetaxel, and of course in addition to ADT. The trial was positive. It was a large phase 3 clinical trial presented first this year at the GU-ASCO, and it showed that there's a survival benefit for those men treated in the triple therapy with chemotherapy with docetaxel, darolutamide, and ADT compared to chemotherapy and ADT alone. So this is the new standard for those men, high risk, which are candidates for chemotherapy. For those men, treated with ADT and apalutamide or enzalutamide, the data are out. It works for all risk groups, for low risk, for low volume, high volume metastatic disease. So this is standard of care. And with abiraterone, this is for those men with 2 out of 3 risk factors, Gleason above 8 or above, high volume disease, or visceral metastasis. So we have a couple of new options, and there are new things going on. And what is really new is, on one hand side, the combination of new hormonal agents with PARP inhibitors. As you know, PARP inhibitors are licensed for metastatic castrate-resistant disease for those men who have a BRCA mutation. And right now we had 2 big phase 3 clinical trials looking at the combination of a PARP inhibitor, olaparib or niraparib, in combination with abiraterone. These trials were also presented first at the GU-ASCO and at the ASCO, and we discussed this here at the EAU. And it's clearly shown that there is a major benefit of the combination for those men who have a mutation in the DNA repair system. The Magnitude trial looked at men with mutation and really could show a benefit. For those men without a mutation, there was no benefit. There was another trial, the Propel trial, for all comers, and they showed a benefit for the all-comer population. So the discussion is really going on, who is the best candidate for this combination treatment. For me personally, I believe it's those with a mutation in the DNA damage repair system. And the last, really big hot topic, blockbuster, was treatment with PSMA lutetium. Again, we have 2 big clinical trials, the Vision trial and the Therapy trial from Australia. So the Therapy trial showed, compared to chemotherapy with cabazitaxel in the metastatic castrate-resistant stage, PSA progression is better with PSMA lutetium, side effects are lower, progression-free survival is better. However, overall survival in this trial, there was no benefit seen. And this was really unexpected. In the Vision trial, it was a trial comparing PSMA lutetium against standard of care, whatever this means. There was a clear benefit in terms of progression-free survival as well as overall survival. So with these, 2 big studies, 2 big trials, PSMA lutetium is now one of the great new options for patients in the metastatic castrate-resistant stage. So there are a couple of new news here from the EAU in Amsterdam, and this is, I think, really important for our patients with advanced prostate cancer. Thank you.